Welcome back to the Chitin Corner. We're so glad you're here to learn all things fungal. Sit back and relax. This will be fun. Because yeasts are pervasive and not killed by standard antibiotics, they can be tricky when they become a problem. They're adaptable to different environments and temperatures and cause a variety of conditions from oral thrush to fungemia and systemic disease. This will be the first video in a series designed for the field of medical lab science, for students preparing for the ASCP exam or equivalent, or for those already in the field looking to expand or refresh their knowledge. Each organism discussion will be from a laboratory diagnosis perspective with emphasis on clinical significance. The content should not be taken as medical advice and is not intended to guide diagnosis or treatment. We'll begin our list with the most prevalent organism and move our way down. If the yeast population was a schoolyard or group of friends, Candida albicans would be the dominant alpha. It is the most common cause of candidiasis or yeast infection, hands down. Infection has been known to occur in any part of the body, and it may also be usual flora of the skin, mouth, urogenital tract, and intestines. It grows in 1 to 3 days, producing colonies with feet which are actually hyphae. These hyphae also make it positive on the classic germ tube test. It is green on Candida chromagar and makes single-terminal chlamydospores on the Dalmau plate. Though in the current era of laboratory medicine, yeasts, including Candida albicans, are typically identified by MALDI-TOF, rendering these classic tests obsolete or utilized as backup methods. Despite this, these methods are still fair game for MLS and MLT board exams. Candida glabrata comes in behind albicans as the runner-up in prevalence. This organism has been on the rise for some time. It's especially problematic for patients with hematologic malignancies, solid tumors, and diabetes. In addition, use of the antifungal fluconazole over many years has helped to select for this organism due to its reduced susceptibility to the drug. Because Candida glabrata has no hyphae or pseudohyphae, it is germ tube negative, unlike Candida albicans. For identification, this organism is most notably positive for rapid assimilation of the sugar trehalose at 42 degrees Celsius. This is a known favorite for a board exam question. As stated before, it has reduced susceptibility to fluconazole. It is mauve-colored on Candida chrome agar, but as with most yeasts today, it is currently identified using MALDI. Cryptococcus is a genus of yeast that includes our number 3 organism on the list. Formerly known as just Cryptococcus neoformans, the organism is now typically identified as a group along with Cryptococcus gattii that causes cryptococcomas, mass lesions, in lung and brain. Cryptococcus neoformans infection may involve the lungs, skin, bone, CNS, or other organs in immunocompromised patients. Meningitis is extremely common in HIV and AIDS patients, and likely the most common cause of fungal meningitis. The most well-known reservoir for the organism is pigeon droppings. In the yeast world, Cryptococcus marches to its own drummer. The colony is wet or mucoid in appearance due to a polysaccharide capsule. This capsule also allows the organism to be visualized on the India ink test, where the black ink doesn't absorb into the capsule. The cells are also notably rounder than other yeasts with buds or daughter cells that pinch off quickly with a narrow connection. The organism is most often detected using antigen testing and is currently identified in clinical microbiology laboratories using MALDI. Since it produces the enzyme urease, this can be used as a screening test since Candida species are negative. Formerly, a variety of agars, including birdseed agar, were used for detection. Candida auris is next up. This species is quickly developing a name for itself as an emerging pathogen due to its multi-drug resistance and ability to cause invasive infections. It also has the ability to survive long-term on surfaces. Before the era of MALDI, Candida auris was frequently misidentified as Candida hemiloni by biochemical and other conventional identification systems. But its ability to grow at a steamy 42 degrees Celsius distinguishes it from others. Commercial chromogars are also now available to screen for Candida auris, but confirmation is by MALDI or other molecular methods. We're going to lump all of the remaining Candida species into one list item as though they're some kind of strange hybrid thing. Candida tropicalis, cruce, parapsilosis, and dubliniensis are the most common species not previously discussed. They are involved in a variety of infections and clinical scenarios in patients who are typically immunocompromised or have underlying conditions. Now that conventional biochemical testing is obsolete, use of MALDI is the preferred method of most laboratories. The Dalmau plate and yeast chromogar can be used as supplementary tools for difficult organisms or mixed cultures. They may have just blastoconidia, yeast cells, or also possess pseudo-hyphae and occasionally true hyphae. Congratulations, you've made it halfway through the list. We will now venture into the more obscure, unusual, and maybe even macabre side of the yeast realm, so prepare to become an expert. At number 6, we have Trichosporon species. These are usually encountered as contaminants, but may cause white piedra, a superficial infection of the hair, and skin lesions. Systemic infection can occur with Trichosporon asahi and is often associated with organ transplantation, multiple myeloma, aplastic anemia, lymphoma, solid tumors, and AIDS. There are several Trichosporon species and all test positive for urea. In terms of morphology, Trichosporon species do it all. They possess true hyphae and pseudohyphae, blastoconidia and rectangular arthroconidia that break off the main hyphae. One of the main features on the microscopic is these rectangular arthroconidia, which most yeasts lack. Colonies are dry and pasty or gummy. Importantly, all species are resistant to the antifungal class known as echinocandins. In at number 7 on our list are Malassezia species. Formerly known as Malassezia furfur, these are now recognized as several distinct species. It is the causative agent of the skin condition pityriasis, tinea, versicolor, but can also be normal skin flora. Famously, Malassezia can be isolated from blood cultures of patients receiving intravenous lipid therapy. I've always thought of Malassezia species as the Italian cousins of the yeast world. It's an easy way to remember that they love to grow with olive oil, and they take on a spaghetti and meatballs arrangement on direct specimen stains. Microscopically, they are very unusual. The oval yeast cells are actually phyllids producing conidia at one end. A delicate structure called a collarette can sometimes be seen. One significant challenge with this organism is the requirement for long-chain fatty acids, often olive oil, which must be added in order to recover the organism in culture. This can be added preemptively to cultures of patients on intravenous lipid therapy as a precaution. As we near the end of our list, we move into some bugs that are really cool but not as life-threatening as those previously mentioned. Regardless, they're very relevant because they're frequently encountered when culturing clinical specimens. At number 8, we have Geotrichum species. This organism is sometimes considered a yeast-like mold or a mold-like yeast as it rides the fence between these two worlds. Often encountered as normal flora, it has been known to produce lesions in lung, mouth, intestines, urogenital tract, and skin. Like Trichosporon, Geotrichum produces arthroconidia and true hyphae, but is distinguished from trichosporon by the absence of blastoconidia and pseudohyphoi. The colony is typically dry, flat, and waxy, but may develop aerial mycelium, giving it a mold-like appearance. It is negative on the urea test and identified by MALDI. On to number 9, we have Rhodotorula species. This beautiful, friendly fungus grows in brightly colored colonies such as red, coral, or orange. It's usually considered a contaminant, but can cause invasive infections in immunosuppressed patients. There isn't much under lab diagnosis for this one. It's brightly colored. You do MALDI. It is also positive on the urea test. Finally, at number 10, it's last but not least. Well, in fact, it is the least pathogenic, but not least where it counts. You know what I mean. Saccharomyces cerevisiae is not known to be very pathogenic, but is commonly known as baker's yeast or brewer's yeast because that's what it does best. It is often encountered in the clinical mycology laboratory if patients are colonized with it or have consumed or handled it. Saccharomyces cerevisiae is a budding yeast with creamy colonies. Acei may also be seen with 1 to 4 ascospores on specialized media. The ascospores stain acid-fast positive. MALDI can be used for confirmation. Congratulations on becoming a budding mycologist. You did great. I'm glad we had Buddy here to help us along. Wouldn't you agree he has been extra good today? He wants you to pet him on your way out if you don't mind. Stay tuned for more on the techniques and tests discussed today. Chromagar candida, MALDI, urea, and the Dalmau plate are some of these essential tools in the mycologist's toolbox that we'll cover in a later video. Thank you for visiting, and please leave a like, comment, and subscribe.